What is congenital scoliosis? Congenital scoliosis means a type of scoliosis which is present since birth. So what is scoliosis? Scoliosis is basically when the spine, which should be straight like this, it is curved like this. We call it the sideways bending of the spine. This is known as scoliosis. So in congenital scoliosis, what happens? The bones, which are supposed to be separate from each other, they are fused since the birth. It might be because of a half-formed bone, which is called as hemivertebra, or it can be because of a bony bar, which is lying on either side of the spine and causing a tethering effect. So what happens? If there is a half-formed vertebra or there is a tethering, then slowly as the spine grows, it grows in the sideways direction, leading to scoliosis deformity like this. Since it is because of a bony defect, it grows very rapidly. No brace is useful for this type of scoliosis, and in this surgery is a must. Normally what happens, if the curve is very fast progressive and it is detectable since birth or soon after birth, at the age of 3 to 5 years, if there is a hemivertebra or an incarcerated vertebra, we do a short segment fixation surgery. Fixation surgery is like we take out that small vertebra which is half formed, we put screws and we stabilize the spine. In this way, we are able to correct the spinal curvature to straight spine again. Second option is if we are not able to do that surgery and we want the growth to happen. Basically, if we want the child to gain height before the final surgery is done, we sometimes put magnetic growing rod or growing rod. Growing rod is something like in the spine, we put screws like this at the top and at the bottom of the curve, and we connect them through a rod. And slowly we distract that rod every 6 months. In case of a normal growing rod, we need to do the distraction every 6 months by doing a small surgery. Whereas in case of magnetic growing rod, there is no need for any surgery. It is done through a ring-like thing, which causes the elongation of the rod, and which we can do every 6 months. So there is no need for surgery. However, once the child reaches the age of say 10 years or 11 years, and we are able to maintain the height of the spine through growth rods and also straighten the curvature, then after the age of 10 years or 12 years, we decide for the final surgery. In final surgery, we do the correction surgery in which we put the screws, we make the spine straight, and if required, we do a osteotomy. Osteotomy is basically cutting the bone. There are many different types of osteotomies. In the most common osteotomy that we do in a fused spine, we cut a triangle out of the bone which is causing the curvature of the spine, and we take that triangle out, we make the spine straight again and fix it with screws and rod. So this corrects the spine and the child is able to have a normal life after that. During these sort of surgeries where there are risks and complications involved, at our center we always do it under 3D navigation technology, which gives us a 3D view of the spine while doing the surgery and protects the nerve. Similarly, we also use neuromonitoring in all the surgeries, in which we are able to do a real-time monitoring of all the nerves during the surgical procedure, which makes the surgery almost 100% successful. So if you have any problem related to scoliosis, or in particular if you have congenital scoliosis, you can send us your MRI or X-ray images over WhatsApp on the number shown below. Thank you. अगर आपको हमारा ये वीडियो पसंद आया तो हमारे चैनल को सब्सक्राइब करना ना भूलें और ज़्यादा से ज़्यादा शेयर करें।